Hi, this is Brian Kim, and this is case number 5 in the best way to do cataract surgery series. I just showed you a case where the lens was stubborn and wouldn't come out. So I used a chopper to manipulate the lens so I was able to remove not only the epinucleus but also the endonucleus as well. In this case, you'll see a little bit of a different approach, similar situation where the lens is stuck, and you'll see how I handle this. So I go ahead and perform my capsular fornix hydrodissection technique. I place a cannula underneath the anterior capsular edge. I place the tip out into the capsular fornix pointing downward. A very nice hydrodissection wave occurs. I decompress the bag and then sweep to the left and right. And then I go ahead and spin the lens. The lens is able to spin fairly nicely, and this should be a mobile lens. I go ahead and irrigate and then lift my incision, and I go in without irrigation to minimize trauma to decimates. I remove the surface epinuclear material. I place the chopper out to the equator, and then I place the phaco tip subincisionally, and then I crush the lens in the double chop maneuver, and then I go ahead and place the chopper out to the contralateral equator, and then I crush the contralateral heminucleus, and that's the cross chop maneuver. I use a chopper to lift the one quadrant out of the bag, and I gently crush the lens material, and I intermittently aspirate and use vacuum and ultrasonic energy. I continue to prolapse the lens material up out of the bag using the chopper, pulling the lens material into the central safe zone, and then emulsify the lens pieces. I'm intermittently crushing and then aspirating and using vacuum and pulses of ultrasonic energy. I go ahead and prolapse this second quadrant out of the bag using the chopper. I'm crushing the lens material again with mechanical forces, and then intermittently using aspiration and vacuum and ultrasonic energy. There's just one more little piece I'm pulling up out of the bag, and I'm breaking this up again. I'm using minimal ultrasonic energy. This is not a very dense lens. You can see the CDE is not very high. And here is where the trouble begins. I'm trying to rotate this lens. I'm trying to dial it up. I'm even using aspiration to try to pull it up. And so it's a little bit of a challenge. Rather than exasperating myself, I go ahead and try a different technique. I'm going to use my right-angled capsular fornix hydrodissection cannula to go ahead and try to rehydrodissect this entire heminucleus. I'm going in with the tip underneath the anterior capsular rim, and I'm just going ahead and pushing BSS along the length of this heminucleus. And I'm just doing this intermittently as I'm going across. And so there's no reason to make yourself frustrated. Try to find a different approach. Definitely going after the pieces with a phaco tip and using vacuum and ultrasonic energy is the last thing you want to do in that situation. So now that I've done this maneuver, I'm able to use a chopper and turn the lens as I need to. The lens is now mobile. Go ahead and perform my mechanical fracturing technique, and I'm able to fracture this 1/3 piece of the heminucleus. I'm going ahead and crushing the pieces in between my chopper and phaco tip, intermittently using aspiration, vacuum, and ultrasonic energy. I have this one last 2/3 piece of this heminucleus. I'm going to go ahead and spin it with the chopper, get around the lens, crush the lens material, and then go ahead and pulse this 1/3 piece, and intermittently using the ultrasonic energy and vacuum to emulsify. Again, this is a fairly soft lens. I'm using crushing forces. I always keep the chopper deep in the bag as I emulsify the lens material in case there is surge or posterior capsule wants to come forward. I'm always protecting the bag at all costs. I don't ever advocate using the ultrasonic energy without a second instrument in the eye. I've seen some surgeons just go to town and use a lot of ultrasonic energy one-handed. I think you can get away with it for the most part, but it's kind of like driving around without a seatbelt. Most of the time you'll be okay, but the few times where you need it and you don't have it, you're going to be in big trouble. And so I never recommend using ultrasonic energy in the bag when you're phacoing pieces without having a second instrument to keep the posterior capsule back. So this case shows how when you have a stubborn lens material, endonuclear material that doesn't want to rotate, you can use the chopper to manipulate and prolapse the lens material upward. You can use aspiration and vacuum to help you as well. But in cases when things are really troublesome and really stubborn, a different approach is required. There's nothing wrong with using the hydrodissection cannula to help hydrodissect the lens material. Again, yes, it was freely mobile. Yes, there was a good hydrodissection wave, but nonetheless, sometimes the lens doesn't move. And so you have to go back and hydrodissect again, and the lens usually comes out. Again, you can use viscoelastic in case you don't want to use VSS, but this is a very effective way to get stubborn lenses out of the bag. So I hope this was helpful to you, and thank you for your attention.